Pano. Oops, sorry. In this scenario, I'm going to use a standard adult size, regular pan. Okay. So I just select that. Okay, and then theoretically the lights should be on the machine for me to go and position now. Okay. So we'll use that control panel. It's going to be difficult for you to get in to that control panel because of the shape of this room.
Yeah.
I've said it almost rubs along this wall. Okay, so I can't bring it any more out this way.
Mm-hmm.
Okay, so I'm going to bring the machine up. So like your previous OPG, if you bring it just slightly above the patient's chin, then they'll have to wait for you to position it. Otherwise, what people tend to do is, if it's nearly at the right height, they'll go and lean into the machine like that, and it's just, so we're going to bring it to the right height. Once we're happy with the position and clean floors sorted out, I've got some little feet that you can stick on the floor, right? So it shows you exactly where the patient's feet stand. Okay, so the patient will come in, hold on to the yellow handles, okay, and then actually, because I can't talk and bite, I'll use the dentures block. Okay, so my chin's just going to go there. Normally I'd be biting onto here. Any glasses, metal, whatever, will be all off. Okay, so patient will stand in. You've got the centre line comes down the centre of the face. Yeah. Frankfurt on the bottom of the eye orbit to the top of the tragus. If it's wrong, then you just move the machine slightly to correct it. Okay. And then the canine beam, I can't quite see where my canine is, but I can move backwards and forwards depending on where my canine is. If I'm happy, then I'm just going to click on ready. Yeah. Obviously you clamp the patient's head as well, sorry. Clamp the patient's head up, holding on tight and feet slightly forward so that it's stretching the spine. Okay. Frankfurt can adjust here as well. Alright, so if it's too high or too low, you can do that. Once you've aligned it onto the eye orbit, then that's a case of moving the machine up and down if it doesn't hit the top of the tragus.
Okay.
Alright. So if I'm happy, I'm just going to click on ready. Okay, and you'll see this blue indicator turns to green. You'll move to the start position. Okay, green. And on the control, on the screen over there, I think it says push the exposure switch.
So if it's green, that means it's ready for exposure,
yeah? Okay, and then you'll see that is also green.
Green, okay.
Okay, so this at this point, we push and hold. We can put my phone on just for fun. So there's something in the image. If it can stay still. Alright. So also just before you take the pano image, you tell the patient roll the tongue to the top of the mouth. Okay? So we'll close your nice new lid door. It should be closed, especially with CBCT, because obviously there's a dose is really high. Then you're going to push and hold, watching your patient, and you'll see the light on the device is turned to amber, so or yellow. So when it's exposing, that's what you hear or see, and it's beeping. At the end, this will go bloop. There we go. Just that.
Is that
And
it?
it's finished. So you can let go now. Okay, that will go back. And in a few seconds, our patient image.
How do you return the? Do you need to
So
return this?
you can click on here, like to reset.
Yeah.
Yeah. Where is it? Here. Oh, just can't remember now. I think it's fine anyway. Just accept this image. So
Or confirm.
so normally you just click on confirm. Okay. So once you're happy, if you do retake, it will hide this image. It won't delete it. It will hide it.
Mm-hmm.
Okay. And reject, same thing. It will hide it.
Mm-hmm.
Okay. But we just do confirm. It's best to always confirm. Okay. So then if we look at our patient. Yeah, you see, this is where the history of the patient would be. So all their OPGs, CBCTs, and other images that you decide.
Would they all be in sequence? Is that
So there's different ways you can have it. You can have it like in date order, so vertically, or by modality, so by OPGs and CBCTs.
Mm-hmm.
Yeah. All right, so yeah, this one is set by date. Yeah.
And if we were to take a new image for a new patient, do we go?
So to take a new patient, you click on here, plus.
So you need to populate all the details.
Create
if
patients,
if it's not linked to Exam Pro.
Yeah. Just name, date of birth, and ID.
Fine. Okay.
Yeah. All right. But now I want to take a CBCT of this patient.
Yeah.
Okay. I'm going to click on acquisition again, and we'll set CT.
Mm-hmm.
Be quick. There we go. All right. So again, we got patient size, child, large child, adult, and then large adult. I suspect you're not going to be doing CBCTs of children. So again, tube temperature, blue light, positioning lights, radio cancel, explanatory. We can change KV and M8 if we want, but I'd suggest you don't. And then we've got the different types of image we're going to take. Okay, so this is 10 by 10 field of view, so it says here, and the resolution. Then this one is a low dose with the same field, or 8 by 10, so slightly smaller field of view. Then this one, 16 by 10, yeah, so that will do like beyond the TMJs, into the eye sockets and down to the bottom of the mandible. Here, 5 by 5, oops, which will, and then you've got the area to select. Okay, so imagine you're doing, let's say, 6. Not everyone's 6 is in the same place, but we can use the blue light to adjust. So I would select this one, and then you can move with the blue light backwards and forwards, up and down, to be in the correct area. Here we've got maxilla, mandible. Okay, so this one is very important. And also, when we're doing these small field of view, when selecting the blue light, you can see immediately that I've selected, let's say, a mandible in this example. And if you wanted a maxilla, you could immediately know that you've got the wrong setting
on the patient.
Yeah.
Would show.
Yeah, exactly. So come out of this one. So this one, regular 5 by 5. This one for endo. You see that you've got the endo tooth, and dose is much higher with endo. And also when I select that, it says endo here. And this one is a 4 by 5. Okay. Then we got 12 by 10, which is kind of really used for TMJs. Yeah, so you've got you'll do one image open, one closed. Then sinus, 14 by 10, so that will go just into the mandible, up into the sinus area. And then this one, airway, which will be the opposite, so just above the maxilla, coming down into the airway. So yeah, right. So I suspect the two that you're going to be using is going to be 10 by 10 and also 5 by 5. Okay. Whether we set this one for our test today or this one, it makes no difference. The endo and 5 by 5 are the same. It's just the dose is different. Image quality be way better on this mode, but dose is significantly higher. So firstly, I'm going to do this field of view, and then we'll set this one. Just conscious of time a little bit, but so we'll click on here. Now, if we go to the machine, we'll position the patient. Yeah. Okay. So fortunately, it's the correct height for me. It's much like setting up a pan. Okay. Some people like to use the dentures holder for CT and put cotton wool roll between, but that's going to be something that you decide clinically. There is also a CT headrest, which some people use, some people don't. Okay, this one will hold people nice and still because their exposure time is a little bit longer. Okay, we'll talk about that on the next session. Okay, so what did I do with the dentures? Oh, it's there. Sorry. Okay. So put that one there. Okay, so same thing, you bring the patient in as before. These are both fixed, so whether I do left or right doesn't matter, okay, they move together. Okay, so we've set 10 by 10. I left the control panel out here, but same thing, I can select the blue light. Machine will move, thank you. Okay. And you see here on here, because I'm not in there, but it's showing me the blue light is on. So if I'm in, you can see straight away the area that's going to be exposed. Mm-hmm. Okay, it's showing left side, but actually it's doing the whole left and right. Mm-hmm. Okay, and so long as the patient is not too much looking up or too much looking down, it almost doesn't matter. Mm-hmm. So long as they're kind of looking straight forward. Line is down the centre of the face. So you've got the red line coming down the centre. Yeah. Frankfurt is not so important, but you can line up as if you're taking a pan anyway. Mm-hmm. Once you're happy, then you just clamp up the patient's head. Okay, and then. If we didn't want that field of view, let's say we want to reduce it down, I can use these buttons on the screen, and you'll see on the patient, yeah, that the blue light is changing where it is. Okay, if I want to maybe reduce down, but I can also do that on this control panel as well. All right, so if it's too small, I can increase like that. Okay, and then once I'm happy with the area that's being indicated, I just can click on ready on here, or ready there, or on the PC, it doesn't matter. Okay, they all do the same thing. Okay, so again, when it's ready, that will turn to green, the exposure switch will turn to green. Okay, I need to shuffle it over just slightly. So it's green, then we push and hold for the exposure.
Thank you.
Okay.
Yeah.
So